Mr. Speaker.
Order. Questions for oral answer. Mr. Melvin Yong.
Mr. Speaker, may I seek your permission also on behalf of Minister Lawrence Wong to take questions 1 to 5 during our ministerial statements to be delivered later in the sitting.
Yes, please. Mr. Yip Hon Wing.
Mr. Speaker, may I seek your permission to take questions 6 and 7 together, please?
Yes, please.
Sir, as of the 9th of February 2022, there were 1,000 individuals who completed the primary course with non-mRNA vaccines and would have their fully vaccinated status expire by 14th of February 2022, yesterday. Persons who are medically ineligible to receive the mRNA vaccine and aged 18 and above can receive the Sinovac-Coronavac vaccine under the National Vaccination Program as a booster vaccine. The use of the Sinovac-Coronavac vaccine under the National Vaccination Program is only for persons aged 18 and above, as the vaccine manufacturer did not include children and adolescents when filing for interim authorization of the vaccine under the Health Sciences Authority, HSA's Pandemic Special Access Route, PSAR. Both Sinovac, Coronavac, and the Sinopharm vaccines are also not currently recommended for routine use in persons aged below 18 years of age by the World Health Organization. Notwithstanding the manufacturer's filing on the use of the vaccine, limited data from the Sinovac-Coronavac vaccine manufacturer's early phase 1 and 2 trials in healthy children and adolescents aged 3 to 17 years old do not show safety concerns. And we recognize the need for alternative vaccines for persons medically ineligible for the currently approved vaccine in this age group. The Ministry of Health has therefore also separately introduced a dedicated public health program, Sinovac after mRNA, SAM, outside of the NVP, the National Vaccination Program, to offer the Sinovac-Coronavac vaccine to individuals aged 12 to 17 years who are medically ineligible for the Pfizer-BioNTech Comirnaty COVID-19 vaccine, to afford them some level of protection against COVID-19 while closely monitoring their safety. SAM is therefore part of a research study which, under our current regulatory framework, enabled the administration of the Sinovac vaccine to an age group outside the scope of PSAR approval. In January 2022, the program was further extended to eligible children aged 5 to 11 years, after the data from the older age group indicated that the safety profile of the vaccine was generally consistent with that of other registered vaccines used in immunization against other diseases. The Ministry for Health is working to bring in other non-mRNA options for those who are medically ineligible. The Novavax COVID-19 vaccine has been assessed by HSA to be safe and effective for persons aged 18 years and above. with 2 doses demonstrating a vaccine efficacy of 90% against symptomatic infection and 100% against severe disease, with the wild-type SARS-CoV-2 and the Alpha variant with no significant safety concerns. Therefore, in February 2022, HSA issued its PSAR interim authorization letter to Novavax for its COVID-19 vaccine. Novavax recently released data that the vaccine was found to be 80% effective against COVID-19 in a late-stage trial in adolescents aged 12 to 17 years in the United States when the Delta variant was the dominant strain. HSA and MOH will evaluate the data from this study and will continue to monitor for more data on its efficacy and safety in children and adolescents. The Expert Committee for COVID-19 Vaccination and the EC19V has also reviewed data on the vaccine's safety and efficacy and has recommended the use of the Novavax COVID-19 vaccine under the NVP for primary and booster vaccination in individuals aged 18 years and older. We hope that the initial doses of the Novavax COVID-19 vaccine will arrive in Singapore within a matter of months, provided that there are no disruptions to the shipment schedule. Meanwhile, those who are medically eligible are encouraged to take available mRNA vaccines as they offer more optimal protection. Thank you, sir.
Sir Pon Wing.
Thank you, Mr. Speaker, and I thank the SMS for his reply. I have a related SQ on COVID. How are the healthcare workers and healthcare system coping with the increased number of infected cases from the Omicron wave? Thank you.
Mr. Speaker, the member asked a question not quite related to vaccines, but on healthcare workers, so I thought I might as well answer. Right now, we are getting cases 10,000 or more on a daily basis. It is within our expectations. We have earlier said that at its peak, we may even reach 15,000, 20,000 cases a day or even more. That's within our expectations. Right now, the week-on-week increase is about 1.5. So it's not increasing at 3 times at one point. But whether cases will go up further, I think that's a possibility, and we should be prepared for that. 20,000 or more, that's possible. Having said that, as we have always said, what's important now is not so much the top-line infection numbers, but how does that translate into disease severity and impact on our healthcare capacity. Yesterday, there were a few written questions, and we put out some responses to that. So by and large, healthcare system is coping well. I give you an example, which is ICU. At its peak, during the Delta wave, we had 171 ICU beds occupied out of a capacity of 200 plus, close to 300. Today, even at 10,000 cases a day, as of last night, it was 23. The week before, at one point, we reached 30, and it actually came down, 23. So we see it hobbling around 20 to 30. And so long as we maintain that, actually ICU is in good shape. And if you look at those who need oxygen supplementation, those who require hospitalization, healthcare system is coping. But I think where we face pressure now is not on the clinical side of healthcare, but on the operational side on healthcare, because the number of calls from patients to our hotlines is increasing. Fortunately, we had the help of many public agencies like CPF Board. SAS stood up a fairly big team, so we are able to answer well over 90% of the calls without them dropping. So that is coping well. But the GPs are facing quite a bit of pressure. Queues are long, and if you go to our community GP clinics, you can see there are queues. So I think on that front, we have to help the GPs. Many patients that go to the GPs, and the GPs feed back to us, they either have mild or no symptoms, but they self-tested, got themselves positive, decided I better see a GP. Either get an MC, can withdraw can get some ART kits from the doctors, and many of them actually worry about travel. If they have to go through a PCR test, they like to say that if I'm a shedder, I register as positive, but they want to show that actually I had COVID and I'm a shedder and I recovered. So for various reasons, people are visiting doctors and GPs not because they are very sick. Yeah. So it's the operational side that's posing a challenge. So later today, MOH will be making an announcement. We'll put out a press release, but just a preview, which is to help with the GPs, we're going to allow our QTCs, our quick test centers, to also allow these individuals to come to the QTCs, go through a supervised ART test, and within 30 minutes, we can ingest their infection record, positive, into their health hub. And from there, they can also withdraw ART kits. What they will not get is a doctor's MC, because that one you have to see a doctor. So that way, I hope we can divert many of the very mild cases away from GP clinics into the QTCs. We have about 200 QTCs now all over, including in malls. We will start with about a quarter of them. So as of end of today, you'll be able to book an appointment with the QTCs and get your go through an ART test and then ingest the record if you are positive into your health hub. I hope that I answered the question.
Mr. Jarugyam.
So there remain about 3% of 12 to 19-year-olds who have yet to get vaccinated. And this works out to almost 10,000 unvaccinated adolescents, not counting children 5 to 11. Given the findings that adolescents and children have a higher COVID-19 Omicron infection rate than older age groups, does the SMS agree that it is better for them to get vaccinated with the Sinovac vaccine than remain unvaccinated? I recognize that it is generally better for them to get the Pfizer vaccine because it's more efficacious. However, these adolescents have chosen not to for various reasons. Anecdotally, from the residents I've met, either they or their parents have a preference for non-mRNA vaccines and are unlikely to change their stance. So why not approve the Sinovac vaccine for adolescents so that they will get vaccinated and our population can reach closer to a full vaccination rate earlier? And secondly, the Sinovac vaccine has already been approved in Singapore for adolescents who are medically ineligible for the Pfizer vaccine. And jurisdictions like China and Hong Kong have already approved it for ages 3 and above. So what are the residual safety concerns to it becoming generally available for children and adolescents? Thank you.
So as the member will appreciate, the issue of safety when it comes to medication, vaccines, medical therapeutics is not absolute. Nothing is completely absolutely safe or absolutely unsafe. It's about the relative risk and the relative benefit. The individuals under the age of 17 who are getting the non-mRNA vaccines currently, the Sinovac, Coronavac vaccines, in those circumstances, because they are medically ineligible for the mRNA vaccine, the benefits of being vaccinated with any vaccine are indeed outweighed by the risks and safety concerns that currently exist for those vaccines and weighed up against the risk of getting a coronavirus infection. But for the others who are not medically ineligible, the data, the safety and efficacy data are quite clear. And we therefore would continue to recommend for them an mRNA vaccine because it's not just about their risks and their immunity at this point in time, but over the next few months, as the pandemic continues to be a challenge for us and around the world, we have to think about how quickly their immunity will wane, what will be their ability to deal with future waves or even this existing wave as it makes its way through our society. So we continue to recommend the mRNA vaccine. And as I've explained, we are trying to bring in other options for these individuals in the near future. Thank you, sir.